On today's World Insight, controversy over KN95 masks at a time of global strain on medical supplies. What's with the holdup? And lessons from the deadliest influenza pandemic of the 20th century, in the words of a respected author.
There's an enemy out there somewhere else. It's not us.
Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you live from Beijing. I'm Tian Wei. We begin today's program with the rapid spread of COVID-19. The pandemic has reached over 200 countries and regions. The number of infections has surpassed 930,000, among which U.S. cases are over 216,000, the highest in the world. Medical supplies are in high demand, while China has been actively supporting other nations in containing the virus. But the U.S. made the decision to reject the Chinese masks imports. Take a look.
The United States became the first nation with more than 200,000 COVID-19 cases, with a total death toll at over 5,000. That's amid shortages of medical supplies. Several U.S. states say masks, ventilators, and other vital equipment are running dangerously low. At this critical moment, the U.S. Food and Drug Administration rejected KN95 masks, a Chinese alternative to N95 masks, from entering the United States. China's foreign ministry said different certification standards should not hinder cooperation between countries.
Chinese companies are running at full steam around the clock to manufacture as many as possible to meet domestic demands and support other countries. It's true that different countries and regions apply different standards when it comes to certifying these epidemic prevention and control products, but I don't think this should become a sticking point in cooperation in such areas.
U.S. President Donald Trump has said Americans should be prepared for the hard days that lie ahead in efforts to stop the coronavirus spread. This comes amid projections that the pandemic could kill between 100,000 and 240,000 people in the country. More states, including Florida, Nevada, Georgia, Mississippi, has told hundreds of millions of Americans to stay at home, though the U.S. president has not issued a national stay-at-home order till now. COVID-19 cases can be found practically in all corners of the world in the past 2 months. Earlier, the World Health Organization warned the number of infections could reach 1 million shortly. The epidemic in China has been under control, with many factories going back to normal working schedules. China has been sending medical supplies and specialists to other countries and regions to help turn the tide against the pandemic.
For more on the controversy of masks and what is really happening on the front line dealing with the fight against COVID-19, we are joined in Providence, the U.S. by Dr. Megan RANNEY, an emergency physician and researcher at Brown University. In Beijing, via Skype, we have Liu Yuanli, the Dean of the School of Public Health at Peking Union Medical College. Last but not least, in Washington, D.C., we have ASHTON, the Senior Director of Government Affairs of the U.S.-China Business Council. I want to welcome the three of you. I hope you and your beloved ones are safe and sound for now. So let me begin by asking you, Dr. RANNEY, I talked to you just days ago, and you were working so hard on the PPE, the protective gears for the professionals in the U.S. What is the latest?
So honestly, nothing has changed substantially in the last 2 days, except that we have depleted the supplies that we already had in the United States. Current reports out from our federal government say that our strategic national stockpile of masks and other protective equipment are basically gone. All of them went to New York City, where they are so desperately needed, but that leaves the rest of the country with no stockpiles. We're working as quickly as we can to identify alternative sources of this desperately needed protective equipment. But unfortunately, the situation has gotten no better than it was when I talked to you a few days ago.
Dr. RANNEY, I've been following your Twitter on a constant basis, and I saw photos and also videos you post there of your colleagues from around the country, how they are dealing with lack of equipment, lack of protection on the very front line, even working in the ICU. People's hearts are broken. Having said that, though, Professor Liu from China, I know you were also earlier from the very beginning involved in China's fight against COVID-19. Protective gears are extremely crucial for professionals, and without them, no one can be saved. So, Professor Liu, tell me more about your experiences earlier with China, and how would you like to compare notes with your colleague, Dr. RANNEY?
Yes, I'd like to say at the beginning that having worked and lived in the States for more than 20 years before returning back full-time on 2013, my heart goes out to 5,000 families who lost their loved ones, and my heart goes out to the fighting doctors and nurses who are now in a very dire situation. Now, at the early stage of the coronavirus outbreak in Wuhan, China has lost some of its finest doctors and nurses due, on one hand, to the lack of awareness among doctors and nurses in non-infectious disease departments, and also due to inadequate supplies of protective medical gears. But that situation quickly improved as the need is realized. And just give you an example. When the 16 temporary hospital with over 10,000 beds were dismantled recently after completion of its mission for treating the coronavirus patients, not a single one of the tens of thousands medical workers got infected by the coronavirus. That's because all the healthcare workers took extremely care. There are strict procedures to go through preparation area, transition area, and then working area with layered of levels of protection. So I think at the critical juncture of time, protecting the lives of the healthcare workers should be absolutely the top priority.
Right.
Because one death, one fallen doctor is too many and too sad. Because with a rapidly rising number of cases and deaths, the healthcare system is being overwhelmed, and the doctors and nurses in the U.S. are at the highest risks of being infected.
Absolutely.
And they need to be protected.
Absolutely, they need to be protected. Any doctors, any nurse that are working so hard these days, they are saving our lives. We should help to save their lives. Dr. RANNEY, before I go to Ms. Ashton about some of the details regarding the business area, let me ask you, how are you said earlier, together with your colleague, try your best to find sources. How are you finding sources? What are some of these sources? What kinds of help do you need, really? Through what kind of channel can you get it?
Yeah, so as I'm sure Ashley will talk about, the supply chain in the United States right now is desperately broken. Governor Cuomo of New York State said a couple of days ago that he felt like it was 50 governors on eBay bidding against each other for ventilators, and we're in a similar situation for masks. The challenge is there are a lot of scammers out there, so people who claim to have access to masks but don't actually have them. And then, of course, we're challenged in terms of imports right now as well. A lot of American manufacturers are trying to ramp up their ability to make this protective equipment, but it takes time to retrofit production facilities. So right now, we're relying largely on donations from existing supplies, so things like beauty salons or construction facilities, or again, manufacturing facilities that may have N95 masks to protect their workers from dust and small particles. a large part of what we're doing right now is trying to mobilize those donations. We have a website, getusppe.org, to help facilitate that. But we're also looking for trustworthy suppliers, which is challenging.
Let me go to Ms. Ashton. Now, the heavy task of where to get the PPEs probably is also with the business community. Tell me more about exactly what's going on now, given your knowledge with the government procedures and also different standards and also the recent regulations. What's going on, Ms. Ashton?
Well, I would just echo that there's not nearly enough transparency in the process. You know, we get calls from member companies and from people in China and other parts of the world on a regular basis asking, you know, how they can help. They've identified suppliers and or they've identified customers and need to contact suppliers. That's not really the business that our trade association is in. But, you know, even trying to figure out the clear path forward for the suppliers and the buyers to be connected and vetted is not simple. On top of that, there's the fact that there's a lot of discouragement, I guess, of importing from China, even though there's no possible way for us to ramp up production fast enough to meet the demand right now.
It's a little bit confusing to me as a journalist to see mixed signals. For example, by 29th of March, the FDA put out the latest notice suggesting what kind of masks should be available and can be available. That included KN95, which is the type that China provides, the so-called model. Well, only 2 days later, that option has been scrapped off that list, even though that is probably the biggest provider of the current standard masks that could be in the world. Ms. Ashton, I know many of your member companies are working very hard to help smooth up the global supply chain. And that's where their life is, in fact. But how would you understand this? And is this out of what reason? How can we, at this point, try to make it happen? I don't know. I want to ask you for your expertise.
Honestly, I think this is a matter of politics being prioritized over American lives right now. I mean, the reality is that, you know, in my community alone, and this is the case all over the place, there are calls for people to make homemade masks to donate to hospitals. I can't imagine that those masks are better than the KN95 masks that China could provide. There is definitely talk on Capitol Hill and from some in the administration about the idea that we are over-reliant on China for a variety of medical and other products. But, you know, the solution right this minute is not to deny China's offer to assist us with the supplies that we so desperately need. And the reality actually also doesn't bear out the idea that we're overly reliant on China. I think we got 5% of all of our gloves and masks from China in 2019. We really don't actually source as much from China as people think, but China has a lot that we can source right now, and we should be.
Mr. Liu, Professor, go ahead.
Yes. I understand, you know, the quality control is a legitimate concern. And as a matter of fact, the Chinese Department of Commerce, the Customs Authority, as well as SFDA, recently jointly issued a new policy to further strengthen the reporting and certifying process for the you know, testing kits, masks, ventilators, and those medical equipments that to be exported. So China has been trying very hard to you know, enhance the quality control, not just for the exported goods or services, but for our domestic consumption as well. But I think the U.S. concern for quality control should not stand in the way of making as soon as possible available those protective gears to the frontline healthcare workers. It's really heart-wrenching to see people have to wear homemade masks or go by the trash bags. I recently read a story about a doctor working in Minnesota who was stopped on the highway for speeding. And when she was handed back her license, and she was very surprised to find 5 gloves, a mask handed by the police. You know, I will be the last one to imagine that the richest country like the United States would have to suffer inadequate supply of protective gears for the hard fighting doctors and nurses. So that situation needs to be urgently resolved. I think I plead here, not just as an impartial expert, but also as a grateful student to my former teachers and former classmates and colleagues working in the healthcare fields still in the States, to the Trump administration to work with other countries to resolve, to harmonizing the regulations so that the trade of essential goods and services that we're talking about and humanitarian aid across borders can be coordinated in win-win manner so lives can be saved.
Dr. RANNEY, let me come back to you. I mean, everything the three of you said, I feel so heavy while talking to you. As a journalist, I need to be very neutral, but it's very, very difficult time. So, Dr. RANNEY, let me calmly try to ask you about this. What exactly is the situation that doctors are trying to deal with the lack of availability of equipment and PPEs? What are some of the alternatives they try to grasp? And also, over the next few days and the next week, which should be the window opportunity because the number in the U.S. is growing very fast in terms of confirmed cases and deaths, what is the most efficient way that you could imagine to get things done, providing the doctors and nurses with the PPEs?
So the situation on the ground really differs depending on where you are right now. For my colleagues that are practicing in New York City, they are literally running out of protective equipment and the other life-saving equipment that they need for patients. My colleagues on the front lines in emergency departments are sharing stories that are just so heartrending and disturbing. In other areas of the country, like where I am in Rhode Island, we still have a couple weeks of stock of adequate protective supplies, and we are doing everything we can to conserve them, but we're likely to run out unless it gets replenished within the next 2 to 3 weeks, which, as you say, is where we predict we're going to see, hopefully, the peak of the epidemic, and hopefully it will start to go down after that. In terms of what the best possible scenario would be, well, I want to offer to Ms. ASHTON, I would be thrilled to talk after this about ways that we could work together to help get that supply chain going and to get donations back to my frontline workers. The hospitals, as you said, are just overwhelmed right now with trying to provide care to patients and plan for caring for patients, and having individual hospitals have to vet suppliers is just crazy. Ideally, it would be a federal response to replenish our supplies and distribute equitably, both to the regions that are hardest hit and to the regions most in need. I mean, I've been in conversations with people at rural hospitals in New Mexico and in Vermont who feel like they've been completely forgotten and who can't get replenishment of their supplies. So we really do need that coordinated response, but in the meantime, we're trying to do it ourselves because we have to. I can't sit and see my friends and coworkers or myself put at risk. And every day that I go into the emergency department, it is with, a little bit of fear, which I don't normally feel when I walk into the ER. We still have great camaraderie and a great team, but we need adequate supplies.
Let me tell you, Dr. RANNEY, Ms. ASHTON, I've been talking to her on and off for years. She's a very supportive person. I'm sure she will be in contact with you about that. But Ms. ASHTON, let me come back to you. I know for you and also your member companies, it's also very difficult because the policies are just not clear. And it's about this today and then about exactly the opposite the next day, making the business community totally confused. particularly now, the cost of business is running so high, as we all know. So, Ms. Ashton, can you figure out something with your member companies? What were some of the earlier experience that maybe can be applied? Can you maybe in contact with Professor Liu, with some of your colleagues that you know in China, and also to try to work a shortcut in a way, Ms. Ashton?
Well, we can certainly try. I mean, we also do have member companies that specialize in doing things like vetting sources and making sure that the supplies are what they are supposed to be. So at the very least, we can put Dr. RANNEY in touch with some of those companies to help try to get the things that she needs, and I hope we're able to be successful with that.
Ms. Ashton, thank you a million. I would say that on behalf of Dr. Ashton. Dr. Ashton, you want to quickly respond to that quickly?
Yeah, I think that would be lovely. I mean, I have a group of physicians and software developers that are working literally 24 hours a day to try to find donations and folks, whether it's folks who have, again, supplies in their back basement or their company, or whether it is larger supplies that we can obtain donations to purchase and distribute. And so collaboration would be just lovely and may help solve this. Again, ideally, this would be done on a government level, but in the meantime, we have to do it ourselves.
Professor Liu, also from Beijing.
Can I
Go ahead.
add one thing? In the field of medicine, there is a so-called rule of compassionate use pertaining to the situation of public health emergency where drugs indicated for other diseases can be and should be allowed to use for the new treating novel diseases without subject to the normal regulatory restrictions. Yes. So in the complicated products like medicine or pharmaceutical products, there is such compassionate use. I think definitely we can work something out in time of emergency for supplying the protective medical gears to the frontline workers they need. This is, the whole world is under attack by a common enemy, coronavirus. So this is no time for pride and prejudice. This is a high time for helping each other. And that's the only and the best weapon we have to fight and win this war against the coronavirus.
Professor Liu, if I could just add a little bit question to you. We also understand China now understand the uncertainty of the pandemic, also try to make sure it has its own sufficient supply while trying to support others. Professor Liu, do you have any advice about this fine balance in a way? Professor?
Well, people working in the public health knows full well that in time of pandemic caused by novel infectious diseases, no one is an island. So it's best, even from the self-interest, to make sure that other countries are taken care of. So in this common fight against the common enemy, the coronavirus, every country must win. We can claim the victory. So China, of course, after a heart-wrenching fight, brought a domestic transmission of the virus, the epidemic, more or less under control. However, we are facing increasing challenging of risk from outside China. So we are making sure we are constantly on guard against the second wave of possible sporadic epidemics anywhere. But at the same time, we're working. We like to work closely together. Actually, increasing number of medical teams are sent to different countries to help. And this is, like I said, a world war. Yeah, we are all in this together.
We are all in this together, indeed. I want to thank the three of you who have all been working very hard in order to fight this war against the virus. Really appreciate it. I really hope there will be real provision of PPE to the real workers on the front line. Thank you so much, Liu Yuanli, Megan RANNEY, and Anna ASHTON. All the best to you and your colleagues. You're watching World Insight on CGTN, still to come on the program. Lessons from the deadliest influenza pandemic of 20th century, in the words of a respected author. That interview right after this break. Welcome back. You're still watching World Insight. I'm Tian Wei. The COVID-19 pandemic has quickly spread to all corners of the world. The WHO said the U.S. now is the new epicenter, with over 210,000 confirmed cases and over 5,000 deaths already. The pandemic bears resemblance to the 1918 influenza pandemic, the worst in history. The outbreak started in an army camp in Kansas, the U.S., and later spread unchecked, killing 25 to 40 million people worldwide, and the latest numbers suggest it is even bigger than that. John Barry, an American author and historian, wrote the book, The Great Influenza, the story of the deadliest pandemic in history, that examines the collision of science and epidemics. Earlier, I had an interview with Mr. Barry. He said the final lessons of 1918 is very simple one, yet the hardest to execute. That is, those in authority must retain the public's trust. While this influenza pandemic is known as Spanish flu, he also explains why diseases should not be named after people or nations. For more, we are joined by John Barry, author of the book, Great Influenza, the story of the deadliest pandemic in history. Mr. Barry, welcome to the program.
Well, thanks for having me on.
I know things are going quite challenging in where you are, New Orleans, so thank you so much for sharing your time at this critical moment, Mr. Barry. Let me ask you by starting to say that we are in another pandemic, as declared by the WHO. But how would you compare the situation then, 1918, to now, Mr. Barry?
Well, unfortunately, there are a lot of similarities. You have a new respiratory virus jumping from animal to human, spreading rapidly. This virus is more contagious than 1918 was, but fortunately a lot less lethal. In 1918, in the developed world, the virus had about a 2% case mortality rate, but in much of the rest of the world, it was much more deadly. For example, in Russia, it's estimated as many as 7% of the entire population died. In Mexico, roughly 5% of the entire population died, and so forth. The virus had probably circulated for a while in China, because China in 1918, at least parts of China where there are good numbers, actually fared better than much of the rest of the world.
Why was that then?
Well, again, if the virus circulated there, the Chinese had experienced it, so their immune systems were better prepared to protect against it. Coronavirus, nobody's immune system in the world had ever seen it before, so it's highly contagious, much more than 1918 or seasonal flu.
Why so many people died in 1918 during that period of a great influenza?
Well, number one, it was a lethal virus. A lot of people died from secondary bacterial infections, probably a majority, but even today with antibiotics and intensive care unit care, it's roughly 8% case mortality for secondary bacterial pneumonias following influenza. And then the virus itself did many of the same things that coronavirus did, or for that matter, SARS or MERS. It could infect you directly deep in the lung, and when it got there, it caused many, many problems, exactly the same pathology that we're seeing today.
Mr. Barry, you were suggesting then, so in 1918, the federal government was lying to the different states inside the United States because there was a war?
Without a doubt.
What really happened? Tell us more about that.
Well, Woodrow Wilson was president. He was obsessed. His entire focus was on winning the war. Because of that, one of his tools was to create this infrastructure of propaganda. They didn't want to say anything that might be faintly considered negative and hurt morale and therefore hurt the war effort. We're not sure where the virus began. We do know it didn't begin in Spain, but it was known as Spanish influenza. So you had national public health leaders in Washington saying this is ordinary influenza by another name. Some patients grew so dark blue from lack of oxygen that the doctor wrote a colleague saying he couldn't tell an African-American soldier from a white soldier. You could bleed not only from your nose and mouth, but from your eyes and ears. All of these are horrific symptoms. So when the public is being told that this is ordinary influenza by another name, the only message they're actually receiving is don't believe anything they're being told.
How much does it have to do with lack of preparedness? But on the other hand, how much preparation one could do or one country could do, really?
Well, of course, in 1918, they weren't capable of doing much. They had great scientists, but they didn't have the knowledge that we have today. Today there's a lot that can be done. Number one, surveillance to identify a new virus when it emerges. China did a great job in getting the genome out there to the scientific world as soon as it was sequenced, so we could get fast start on using supercomputers and artificial intelligence to match up drugs and simultaneously, work on vaccines. One of the main lessons from 1918 involves social distancing. China took extreme measures, obviously. South Korea, Singapore. I think one of the main lessons from 1918 was if you tell the truth to the public, you will get a lot better compliance and a lot more sustained compliance than you will if you lie. If you lie, you lose public trust and you don't get cooperation.
So at that time, mainly the states in the United States, for example, were relying on themselves. How would they be able to, gather all the resources to do what they desired to do if the federal government was not that much of help?
Well, in 1918, the federal government really didn't play a role. Wilson, the president, never made a single statement on the pandemic at any time. The federal government provided very little in the way of resources. But of course, society was very different then. We didn't have the supply chains and the international connectedness that we have today. A lot of things were much more locally sourced or regionally sourced. But it largely became every city for itself. The very first cities hit happened to be Boston. Nurses and doctors from all over New England did flood into Boston to help. This healthcare system there was overloaded. But very soon, every healthcare system was overloaded.
Mr. Barry, having heard what you just said about that part of history, made us to think twice of what's going on right now. First of all, let's trace back some of the debates about the overall strategy to take. Social distancing or not social distancing, or so-called herd immunity, as you may have heard that phrase earlier in the debate. So let's go through some of these issues. Overall strategy. Herd immunity is about, okay, those who have better immune system, they will survive, and let's hope there will be vaccine, and let's hope that the virus will get weaker as time goes by. Now, scientifically speaking, one could understand that theory, but how is that theory viable anymore under the current circumstances when it comes to society's choices?
Obviously it would depend on the death toll. If the death toll were 0.001%, then that would make a lot of sense. If the death toll is 1%, well, then it's more contagious than influenza. If you're infecting 50 or 60% of the population, 1% is an awful lot of dead people. And I don't think anyone who really looked at those numbers, even the hardest-edged, pure economist, would think it was worth the price. I do think that this virus will come in waves. It will return. It's here, I think, now probably forever. But I also think probably the second time around, people's immune systems will recognize it and be able to deal with it a lot better. So I don't think it will always have the same kind of fatality rate that it has now. I don't think it'll be that dangerous. So that leaves the other equation, part of the equation that you mentioned, social distancing. As you're probably aware, the United States, frankly, has done a terrible job on getting testing out there. In Korea and Singapore, the testing is very important in the control of the virus. They were able to test, isolate, contact trace, and effectively maintain an edge over the virus without really widespread disease, and also maintain their economic activity.
You also see the difficult choices that the state of New York, the city of New York, state of California, in your country, just a few examples reflected by the rest of the world, had to choose. So what do you make of the overall strategy when our economy is developing? What should be the priority, though?
Well, I think given the fatality rate and the vulnerability of the population, it has to be health first. I hope that he is convinced by his advisors that he's wrong. If he continues down this path, it will turn out to be an advantage that we have a federal system. The actual public health decisions, the federal government does have power to do more stringent things than a state, but if a state wants to impose various restrictions, the federal government would have no power to order that state to lift those restrictions. So, it would be terrible messaging. It'd be difficult to get people to comply if Trump were to say, let's lift the sanctions, or not the sanctions, but the measures. But states could still leave those things in place and ignore what his recommendations were. Getting compliance would be difficult, but legally the states would have the authority to do whatever they wanted.
Another question, I want to trace back the history a little bit, because there were a lot of debates about where the virus come from, what should be the name of it, and it's becoming even a geopolitical debate. But now, of course, things have been settling down somewhat compared to earlier days. But this also brought up an interesting topic about why it's called the Spanish flu, because many believe, even by scientists and epidemiologists, that the virus at that point, at least apparently, started inside the United States and then spread to other parts of the world, and then coming back to the U.S. once again to be a bigger scale pandemic. So, Mr. Berry, as a historian and as an epidemiologist yourself, how are you looking at these debates?
Well, As far as the history goes, the explanation is pretty simple. The King of Spain got sick, made it a major story around the world, so warring countries wrote about it. It became known as Spanish flu.
Mr. Barry, WHO has been repeatedly saying that there should not be the name of a person, name of a place, and name of a country that should be used in the name of a virus. Do you, as a scientist, as a historian, support that?
Yeah, absolutely. I mean, I think, frankly, Trump is strictly political reasons. You know, his whole shtick seems to be there's an enemy out there somewhere else. It's not us. He likes to blame someone else. He's never accepted responsibility for anything. I don't think that name is going to stick, even in the United States, even when used for political purposes, as it has been.
Mr. Barry, I really hope you would take good care of yourself and also your family.
Yeah.
Let's be united in a way to go through this very difficult process.
Thank you very much, and the same to you.
John Barry, the author of the book, The Great Influenza. A lot to be learned from history. Are we learning? I hope so. And that is all the time we have for today. If you'd like to see more, you can try to find us, World Insight CGTN, into your search engine, or check out our YouTube channel. Follow us on Twitter and Facebook accounts. I'm Tian Wei. On behalf of the team, thanks for watching. Bye for now.